everyone, welcome to my channel Ravi Aesthetic Physio. So in the series of pharmacology, we are moving further and taking another topic which is vasodilator. It is also a part of cardiovascular system. So vasodilation is a drug. Vasodilator is a drug. So why we are using the vasodilator? If the patient have the myocardial oxygen demand is less is as to appropriate level due to thrombus, embolism, or any kind of plague or atherosclerosis. On that time, we are using the vasodilators for dilate the vein, arteries, or capillaries for the permeability is to be smoothly. So the introduction of vasodilator, they reduce the cardiac workload and myocardial oxygen demand and ventricular filling pressure by reoccurring vascular smooth muscle causing dilation of the arteries and vein. So I guess you have to like aware about that in the introductory part. So there is any kind of constriction due to an plaque formation into the arteries or vein. So on that time we are taking the vasodilator to increase the dilation of the arteries or vein for the increase the permeability of the blood vessel. So the types of vasodilator: first, vasodilators are nitrate, isosorbide. Second is to be arteriolar dilators. Example is to be hydrolyzine. And third is to be mixed vasodilator. Example is to be ACE inhibitor, angiotensin converting enzyme inhibitor. Example is to be lisinopril. So what is the action of the vasodilator? First, nitrates. It release the nitrogen oxide and increase the GMP and cause the vasodilator. It means the nitrogen oxide cause the clumping of the blood vessel and breakdown of the atherosclerosis or plaque formation into the blood and increase the blood dilation for the increased permeability, and it's decrease the preload of the blood. Next example is to be arterial dilator. It means it dilate the arterial. Example is to be hydrolyzine. So it directly act on the arteries, and nitrates are directly act on the veins. So what is the what hydrolyzine do in our arterioles? So it directly dilate the arteries and decrease the afterload. So keep this thing in mind. First, venodilators are decrease the preload, and the hydrolyzine are decrease the afterload of the blood, and the angiotensin converting enzyme inhibit the converting of the angiotensin 1 to angiotensin 2, and it decrease the vasoconstriction and decrease the aldosterone level for relaxing the capillaries or arteries for smooth permeability of the capillary of the blood movement into throughout the body. So what is the pharmacological action if you are taking the medicine? So increase the cardiac our workload. So it will be what is the meaning of cardiac workload? It means the vasoconstriction is to be occur and increase the arteries or vein to carry the blood in the high into higher amount, because the constriction is to be there, and if the constriction there is a blood level is to be high and the BP is ultimately high in our blood level. So it dilates the blood vessels either into the vein or into the arteries or into the mixed capillaries, arteries or vein. So it dilates it and decrease the heart rate, decrease the workload of the cardiac muscle, and increase the cardiac output. It means there is approximately appropriate amount of blood came into the right atrium. Next is to be decrease blood pressure and prevent cardiac remodeling into the Next is to be indication which time we are taking the vasodilators. First is to be chronic heart failure, acute heart failure, hypertension. It means there is a chance to present of atherosclerosis, plague into the heart, into chronic or acute. You are take the vasodilators, and in the hypertension, high blood pressure due to the constriction or narrowing into the blood or arteries or vein. So on that time you are taking the vasodilators. And what is the adverse effect if you are taking too much vasodilators? So the nitrate cause the headache, hypotension, and reflect tachycardia. It means nitrate, if too much nitrates are present in our body, cause headache, sometimes dizziness, And the hypotension, it will decrease. Sometimes you are taking too much nitrates, so it decrease the blood pressure into the body. And tachycardia decrease the breathing out output. And next is to be hydrolyzine. It's directly act on the arteries. So what the symptoms to be so adverse effect: lupus like syndrome and tachycardia, abnormal or increased heartbeat, or increased breathing pattern you have to shown. Angiotensin converting enzyme, it cause hyperlipemia. It means there is a in like increase the potential level into the blood. Dry cough, you have to severe dry cough on the time. And angioedema, it means there is a fluid accumulation into the uh, blood vessel, for the causing the edema. So that is the vasodilation. Thank you.